Hi, my name is Dr. Julian Camastra from Canada. I have been practicing dentistry since 2016, and I've recently, in the last 2 years, I've been transitioning into biological dentistry, starting with SDS and the Swiss Biohealth Clinic, and now I'm upgrading my knowledge and my experience here with Dr. Dome and the Biodentistry 3.0 course. The Academy has really transformed the way that I look at the connection between oral health and overall health. I actually look at it now as maybe central to overall health. I'm very involved in general medical interest and optimal health. And now whenever I'm hearing about different patients and their health problems, or even family or friends, now my mind is going straight to the mouth, like what problems, what foreign materials, what interferences can be in there contributing to the stress that this patient is dealing with. And I don't think now that I have this education, I don't think any overall medical health approach is complete without paying attention to what's going on in the mouth. So this is something that we as the biodentists need to really help in pushing the envelope forward with all medical fields and educating our colleagues, our medical colleagues, the connection between oral health and overall health. Because if you're ignoring this part, then I don't see how you can fully recover from any sort of chronic disease or condition. Since implementing these concepts into my practice, I've noticed with several patients now some very, very profound transformations in their overall health, particularly relating to the meridian systems. So the most obvious one that I see, and probably many of my colleagues now practicing this way see, is some kind of dental infection, like an infected root canal tooth. And once you remove it and clean it out properly, and you use the nutritional design to support their body through it, different symptoms that they're having somewhere else in their body clear up. So I have a particular case like this, and she told me after about 2 weeks of healing after the surgery, her body just let go of all this retained fluid. She had inflammation in her joints, and it just let all of it go. And she said she let go of 5 pounds of extra fluid that she was just holding on to. And then all of these other symptoms down the side of her body that the infection was on, they all cleared up. And she was experiencing these things for a few years. And after that, everything just slowly went away. So that, for me, it was really powerful and demonstrating that this stuff is real, and we can have an amazing impact on the health of our patients. What's been amazing about the biodentistry program is Dr. Dome has been doing this a long time now and treated thousands of patients, and he's really refined the protocol and the approach to a science. And that's kind of what I wanted. I wanted something that I could put my name behind, and something that's backed with some clinical evidence, and that's what they've done. So there's no guesswork. The approach is solid. There's many patients who have gone through this treatment protocol and healed amazingly well and transformed their health. So that's I think the misconception about biodentistry, biological dentistry, is just that it's not scientific, and they've definitely overcome this with the Biodentistry 3.0 approach. So the personal customization and personalization, that was really the amazing part that blew me away. And Dr. Dome just dedicated his entire day yesterday for me. He wasn't in the clinic, he wasn't seeing patients. It was just spending the whole day together, talking, getting to know each other, and then answering all the questions I had, showing me all the things in the clinic, introducing me to the different people on his team. And this was really, really amazing. And the other part was the look into my personal health. So that was the other component. Obviously, we don't get so much in any other type of dental education, is actually you become the patient. We look at, in my case, we looked at my health, how we can optimize my health. And then through that, I'm learning how I can then apply that to my patients and teach them. One thing that I would tell to any other dentist or any other dental, someone who works in the dental field, to motivate them to look into these concepts is, what would you want for yourself? What kind of treatment, if you were the patient, if you or someone close in your family had to go through some kind of dental surgery, how would you want it done? If you're someone like me who cares a lot about their health and is always trying to improve his health, you want it done the best possible way with the most biocompatible materials and in an approach that is going to have the optimal healing and the optimal outcome without any negative consequences on your health. So that's what led me into this, is I needed some treatment, and I did all the research, and that's what led me to biodentistry. And I figured out, okay, this is how I would want this done on myself. And then once I did that, there was no turning back, and I couldn't do it anymore the old way that I was doing it with my patients, because now, I wouldn't want it for myself. Why would I want it for my patients? So I think this is the most powerful motivator for other dentists, is really sit back and think, like, how would you want it done in yourself or your family, someone close to you?